Great to see all of you. I'm Jonathan Bowles. I am the Executive Director of the Center for an Urban Future. It's so great to be here. In case you are new to us, the Center for an Urban Future is a think tank focused on creating a stronger and fairer New York City and expanding economic security for all New Yorkers. You might know Cuff from our research on how to ensure that more CUNY students succeed, or our reports on the need to scale up job training programs that work, or our work on how to boost the number of good jobs in New York, or our studies detailing the vital role of public libraries. But for a decade now, a growing share of our research at Cuff has also focused on what my colleagues and I believe is one of the most important, but also one of the most underappreciated set of issues facing our city's future: the need to plan for an aging city and boost support for New York's rapidly growing older adult population. Our most recent research, published earlier this year, shows why this needs to be high on the new mayor's agenda. It's not just that the city is home to a record number of older adults today, about 1.3 million. It's that an alarming number of the city's older adults are facing a financial insecurity crisis. Over the past decade, the number of older adults living in poverty has surged by 41% across the 5 boroughs, 41%. As a result, today, nearly 1 in 5 older New Yorkers, those aged 65 and over, are living below the poverty line. On top of these already concerning numbers, our research suggests that even more older New Yorkers have no stable source of retirement. 19% of the city's older adults report no Social Security income, nearly double the national rate. And an astonishing 59% did not report retirement income from other sources. Over the last decade, the city also experienced a 66% increase in the number of older adults who are working. Now, there's no doubt that some older adults are choosing to work past retirement age as they live longer, healthier lives. But the 66% spike that we've seen in older adult employment also suggests that many are likely working out of necessity, struggling to keep up with rising costs and inadequate retirement savings. These last several months, we've heard a lot about the very real affordability crisis facing our city. That's a very, very good thing. But so far, older adults haven't been a big part of the conversation. That needs to change. Because as our research shows, few New Yorkers are feeling the strain today more acutely than the city's older adults. Today's forum is all about raising the visibility of these issues and exploring what city leaders can do to ensure that older adults' unique cost of living challenges are front and center today as they tackle the city's affordability crisis. We have an amazing group of speakers here to delve into this topic today. So thank you to all of our speakers that are here. We're so glad and appreciative and can't wait to hear you on the panels. And especially big thanks to AARP New York. Can I get a hand for AARP New York? AARP's support not only made today's event possible, they also provided the support that enabled our recent report about the financial security crisis facing older adults in the 5 boroughs, and another report we published this year on the growth in older adult poverty across the state. Beth Finkel, thanks for the support and for all you do for New York. Thanks, Beth. I hope you'll all indulge one final thank you to Cuff's amazing staff, and especially to Rachel Netches. Rachel, are you here? I want to single Rachel out just because she has led our work, our research on older adults, and she gathered all of the data points that I mentioned today. And I know I mentioned a lot of data, so thanks, Rachel. Now let's get this started. If all our panelists can come up, and I'm going to turn it over to our always excellent editorial and policy director, Eli Dvorkin.
You're perfect right there, yeah. Great. All right, thank you, Jonathan. Can everybody hear me okay? All right, well, good morning. Morning.
All right. Thank you so much to everyone for being here, for joining us, and for the folks that are also tuning in online. We had a couple hundred RSVPs online as well, so folks are definitely interested in this topic, to say the least. And for good reason, I think, because as Jonathan mentioned, while arguably no New Yorkers are feeling this affordability crisis more than our 1.3 plus million older adults in New York City, we haven't heard a whole lot about how this affordability challenge is kind of coming home for our older adult population. And we want to do something to change that with this conversation today. So thank you all so much for joining me. I'll briefly mention who is up on the stage with me. Their full bios, it would probably take me the entire rest of the program to read them, so I won't do that. They're in your if you scan those QR codes, you'll be able to read up about everyone. But I'll just mention briefly, I'm joined today by Beth Finkel, the New York State Director for AARP New York, by Grace Bonilla, the the President and CEO of United Way of New York City, by Kevin Kaprofsky, the Director of Public Policy for Live On New York, Murad Awada, who is the President and CEO of the New York Immigration Coalition. So quick round of applause for amazing panelists. I truly cannot think of a better group of folks to have this conversation with today. Well, let me start by asking a little bit about what you all are seeing on the ground that kind of brings home some of the data that Jonathan shared earlier. And maybe, Wayne, I'll start with you, in part because you've got a disproportionate role as this one service provider up here on the panel today. And thank you and your team for everything that you all are doing to really combat these issues every day. But, as Jonathan mentioned, look, with nearly 1 in 5 older adults in New York City living in poverty, and we'll bring in Grace in a little bit, but obviously many more beyond that poverty measure that are really struggling with these financial insecurity challenges. What are you seeing firsthand? I mean, when you kind of talk to folks in your community and the New Yorkers that you serve every day, how does this affordability crisis show up in the lives of the older adults you serve?
So first, thanks for inviting me to be here. I want to acknowledge that in the audience is Poling Ng, who's our Associate Executive Director and Director of Senior Services. She's been with CPC 58 years of our 60 years. Wow. So you can see the empowerment that exists with older adults. So Chinese American Planning Council, we're the largest Asian American social services nonprofit in the country, and we serve 80,000 New York City residents every year. Over 50% of the community members that come to CPC are age 55 and above. So they're part of our mental health programs, digital inclusion, affordable housing, senior centers, home delivered meals, home care, the list goes on. But in terms of the needs that we're seeing, last year we opened up our new mixed-use building that has 210 units of senior affordable housing. The city lottery system had over 50,000 applicants for 210 units of affordable housing. Last week, we did a food distribution in Brooklyn, and usually 300 folks come. Actually, sorry, let me go back. Last month, because of all the SNAP pauses, we usually have a food distribution that has 300 older adults come. Over 1,800 older adults were in line for food, and we only prepared for 300. And when we looked on our security cameras, folks were lining up at 3 a.m. in the morning just to get their food. Every day at our 4 older adult centers, which serves about 1,200 older adults every day, we know that the lunch that we serve is most likely their one hot meal of the day. And they bring in their own container so they can take the food home so that they have a meal for themselves or for their partner or for their family members. We provide home care to over 6,000 older adults and some folks with disabilities. And that's one of the main ways that they can age in place. And one of the reasons we fight for higher wages for home care workers is because often it's family members that are taking care of their older family members. So the list can go on, but what we do know is that when you are foreign born, when you don't speak English, when you might have a certification or a license to work in a profession in another country that is not recognized here in the United States, you really depend on what your social networks are, and that oftentimes are social services organizations that see an individual as a whole person, and we want to make sure you're healthy, we want to make sure that you're included, we want to make sure you're empowered, and we want to make sure you're safe and you're healthy. And that's where we need to make sure we have food, we have housing, you're educated, you're employed, and you're still civically engaged in the community.
Yeah, thank you, Wayne. Well, I want to ask more about how maybe the next administration can help do all of those things. But first, Grace, let me bring you in to talk a little bit more about the problem that we're seeing today. And in particular, that rise in older adult poverty is so alarming. But as research from United Way has shown, it's not the whole story, meaning it's not only those who are below the federal poverty line that are struggling. Can you help us kind of understand that a little bit better?
Absolutely, and thank you for having me. So one of the issues that we have, and many of us know this, is the official poverty level at the federal level does not account for geographic expenses. It doesn't account for housing. We have the supplemental poverty level that the federal government also uses, but it still falls too short, which means that even though Wayne is seeing all of these folks that are officially poor, we have a number of people, especially in the aging community, that are not even counting as poor but are not able to make ends meet. What does that look like? So we depend on our true cost of living, which has been a report that we've put out for over 20 years that most recently showed that about 50% of New Yorkers can now make ends meet. That's regardless of age. It starts to vary depending on age and depending on where they live. For older adults, that means about 67% of New Yorkers that are led by a household of someone who's 65 or older are not able to make ends meet. So and I want to make sure that I get this right, when you start looking by borough, in the Bronx, that's 77% of households led by someone who's 65 or older, not able to make ends meet. In Brooklyn, it's 72%. In Manhattan, it's 67%. In Queens, it's 66%. And in Staten Island, it's 58%. I recently also saw a stat that for the first time in history around the world, we're going to have 1 billion people that are 65 and older. So we are not just an aging city, we're an aging global world. So those are the things that we're up against. And we do need to have a very comprehensive conversation about how we attack this, not just from one particular aspect, right, which is many times it's how do you age in place? How do you make sure that medicine is cheaper? It has to be a more comprehensive, all hands on deck on employment, housing security. When we talk about poverty, it has to be from an aging perspective.
Yeah, thanks, Grace. Beth, I saw you nodding your head. I mean, do you want to help us just a little bit more with the kind of framing where we are right now in terms of, you've been working on these issues for a long time, ARP New York even longer. Is it different now? I mean, are we really dealing with something that feels more like an acute crisis? And how is that showing up in your sense of the challenges facing older New Yorkers today?
Well, I would point back to your data, right? Your data has shown us that we're in a whole new frontier here, especially with the percentage of people who are going to be in poverty. It is the first time that in New York State, there are more people 65 and older than there are 15 and younger. Again, back to your stats. So we're talking about a whole new aging frontier and how we have to think about that in this new era of aging and how we have to look at that equity and inclusion of aging. We often hear it for a myriad of other populations, but it's very rare that we hear ageism, age inclusion, and really making sure that disparities around aging disparities around aging are addressed. And I'll give you two really quick ones. One is EITC. Everybody knows what EITC is, right? Earned Income Tax Credit. Well, the federal government stops EITC at 65. But the state government has an opportunity to change that because you're working, you need to work. You wake up at 65, and all of a sudden, that earned income tax credit is gone. You're 64 and 364 days old, and you get it, and then it stops. Well, if that doesn't smack of ageism, I don't know what does. I'll give you another example. Data matching, and Grace and I have talked about this for a long time, right? Why is it that the state government can do data matching for children and families, but we're not doing it for older adults? Do you know, if we just data matched the Medicare Savings Program, it would put $170 a month back in people's Social Security checks who are eligible. That's a lot of money, especially with the threats on SNAP and things like that, that they're getting less. I mean, that would literally put the food back on the table for folks. I could go on and on.
Well, I'll make sure you do get the chance to tell us more about that. I mean, I love those examples. I think I want to come back to also the issues around federal cuts and around work. But Murad, I want to bring you in because something else that Beth mentioned, the growing diversity of our older adult population, is part of the reason why we wanted to have you as part of this conversation. And in particular, from our research, we showed even just a couple of years ago, for the first time in decades, probably about a century, that the share of older adults in New York City that were born outside the United States is now 51%. So most of our aging population in New York City now was born outside the U.S. That's the first time in a long, long time that that's been the case. And it's reflective of other changes in our aging demographics. Our older adult population is in every possible sense more diverse than ever. But I think this shift is an important part of why we're seeing some of these financial insecurity challenges. So I was wondering if you could speak a little bit more about when you think about the impact of financial insecurity on our older adult communities, our immigrant older adult communities. What are you seeing there?
Well, I think the other piece here, is this on? Okay. The other piece that isn't really reflected in a lot of the data is that older immigrant adults who don't have status are still stuck in an immense amount of limbo. And with the heightened concerns that we're seeing right now across the city, the state, and the country with the federal administration's attacks on immigrant communities, what we're seeing is that they're not discriminating on people on who they're going to detain and try to put through deportation. But what we have been seeing is that the older immigrant population who has been working here for decades, undocumented, has no real recourse in getting any supports. And there were no supports before, and the little support that we actually won not too long ago, a couple of years ago, was expanding Medicare eligibility for the undocumented who are 65 and older. And now that will potentially trigger a public charge for them under the new public charge rules if they were ever able to get status. So undocumented folks are not eligible for the public benefits that most New Yorkers are. So when we're talking about people's ability to afford to live here, afford to eat, we're seeing that significantly worse within the immigrant communities who don't have status. And for the moment that we're living in right now, there is a recent report that came out that people who are earning up to $150,000 are struggling to buy food. People who are earning $150,000 are struggling to buy food. Wayne spoke about 1,800 people showing up when historically it's been 300 showing up to their food pantry. I encourage anyone to go to any food pantry across the city or the state of New York and see what it looks like. And this is probably the first time in a long time when we start talking about age population and growth. We're not seeing the growth coming from the bottom. We're seeing the growth coming from the top, and the top being our older New Yorkers. And the people who have historically taken care of older New Yorkers have been immigrant workers. And as they're aging, you're also seeing that they have no opportunities to get the supports that they have been providing to others. So this is a really interesting moment. We just saw the largest wealth transfer in U.S. history with H.R. 1, which is pretty much robbing the poor to give more tax breaks to billionaires at the expense of SNAP, healthcare, and other public good that the government used to subsidize. So we have to ask ourselves the question, what are we willing to fight for as a city? So what can city government do? And then what are we willing to fight for as a state? And what can the state do to not fill the gaps? Because I think that that's like the wrong mentality to walk into this conversation with. But these were problems before this administration came in. Every administration has come in. How do we actually have a real solution so that people can continue to live with dignity and age in place with dignity and ensure that they can continue to, thrive here in New York City and New York State?
Thanks, Murad. I mean, I would definitely want to talk to all of you more about what those solutions should look like for the next administration. And if you know the Center for Urban Future, we're going to spend most of this conversation there. But I did want to ask a little bit more about some of the drivers of the insecurity that we're seeing, poverty, as well as, broadly the kind of affordability challenges that older adults are facing. Kevin, I'll bring you in on this. Tell us a little bit more about what you see as the key drivers, the fact that we've seen poverty skyrocket, that more and more older adults are struggling to be able to make ends meet. A survey data from the Department for the Aging showed, about 40% of older New Yorkers are reporting they can't pay a bill that they have every month. Similar numbers when it comes to folks that say we can't afford fresh food on a regular basis. But what are the biggest drivers here, both in terms of the costs, but also in terms of the income side of this, and help us understand, where you see the problem growing?
Yeah, so I'm really glad that Beth brought up ageism earlier, because I do think that this affordability crisis has existed for older adults for a long time, and we're now looking at it because everybody else is facing the affordability crisis. So this has been something that has been developing, and our members have been seeing this. Older adults have needed supports in our city for decades, right? For just basic food support, for basic housing support. And I think a lot of the drivers are, they're threefold. One is that our systems have not realized that as we grow older, we do need more supports over time. So our systems are acting like it's 1970 and people are only living to 62 and people are living into their 90s. They haven't actually adapted to see that. The second thing is a lot of the supports that people get have stagnated over the last decade and a half. I mean, look at Social Security checks. Some people are still living on $15,000 a year. That has not changed in a long time. These are like key things that could have been fixed 10 years ago, could have been fixed 15 years ago, and it's really exciting that we're looking at them now because an overhaul would help a lot of people. And to bring it back to the ageism part, and I know earlier in the discussion we talked about older adults working, there's a lot of older adults who need to work, and there's a lot of older adults who want to work. It's very difficult as an older person to gain new employment after 55 or 65. And it's also very difficult to keep your employment after that time. Ageism is rampant in employment across any sector. I'm sure we've all seen it. I'm sure we've all heard the conversations amongst our colleagues or even amongst HR talking about older people in a denigrating way. I think, getting the income up is one very important way through Social Security, through other benefit programs. But, there's a lot of programs that help supplement that already exist in the city. I mean, just as Wayne was saying, we represent over 100 social service organizations that provide food, housing, and supports. And probably the best interim solution is to bolster those systems so that folks can eat. We're seeing the largest number of homeless older adults in history right now. So what we have to do is invest in housing, right? To make sure people can not become homeless. It's very direct there. And just as an example of the stagnation that's causing people's affordability issues, providers have not seen an increase if they run older adult centers in food costs since before the pandemic. And I just want to say to everybody, has food changed in cost in the last 5 years? Yes, but providers are still using the same amount of money to serve the same amount of people. Imagine if you had to do that. It's crazy. So for me, I would say that a lot of the drivers of this are people not paying attention, people not making investments. And I'm actually very excited, a new administration, new conversations, new understandings, and really frankly saying like the situation that older people in New York are in has been dire for a while. And it's showing up more than in other populations because this is what happens 10 years into an affordability crisis for people. You start seeing more homeless people than ever. You start seeing more, food insecurity. And honestly, 10 years from now, this is where everyone's going to be if we don't start to take this seriously.
Yeah, thanks, Kevin. Let me ask you then all a little bit more about kind of some of these other drivers. We put on the table, Murad, you're talking about older adults without status, a growing number of them in New York City, maybe a significant contributor to why we have this shocking level of New Yorkers who aren't able to access Social Security. It's one kind of piece of the puzzle. We've got the 60% of older adults who have no retirement income in general, a broad problem across New York City. And then we also have folks that want to work longer, that need to work longer, that are facing, among other challenges, age discrimination in the workforce, challenges around accessing services, workforce development services for older adults, all sorts of things on the kind of the income side. And then obviously on the expense side, you mentioned housing, among other things, nearly 27% of older adults say that they are housing insecure. That's when they're surveyed. Arguably, the number is even greater when you look at the folks, obviously, that can't afford the situation that they're in, currently. And then you've got, rising costs for food and utilities and everything else. So I'd love to kind of hear your thoughts about, as you start to assemble, as we together right here on this stage, start to kind of assemble a policy agenda for including older adults in an affordability agenda. What are those kind of key ingredients? I'd love to talk about both the income side and the cost side. I'll leave it open to all of you to kind of kick things off, where you'd like to kind of prioritize things. And maybe I'd frame it that way. There's a lot that the incoming mayor has promised to do to address affordability. Some of those things may impact all New Yorkers. Some may be more targeted at certain populations. A lot of those things may require real partnership from the state. But I'd love to ask you all as a starting point, in these first 100 days of a new administration, where would you advise the next mayor to start when it comes to, hey, you have swept into office with a mandate to tackle affordability, but we haven't heard so much about our 1.4 million older adult neighbors. Where would you recommend that the next administration begin?
The co-chair.
I'm here to listen.
I'll let Beth maybe
take
jump
all
in,
the
and I'd love to
way
hear
down.
everybody's thoughts.
I think I need to go back to what I was saying before. We really need to be an age-forward society. I think we need to reframe how we think about aging. I think the points that the other panelists made about the longevity that we have here and how that needs to be addressed. There's two things I would say. First 100 days, right? The first two things I would say is we need a deputy mayor for aging equity and inclusion. And we need to rethink how all of the work that we do around aging fits under that. And it needs to fit under more of economic drivers. I think that we've all addressed that. It's not, I shouldn't say it's not. Social services are absolutely a mainstay and so important. But we need to bring in the broader spectrum of New York City government that can help here. And the economic drivers are the ones that we need to look at more seriously. And then I've got to go back to what Kevin was saying in terms of the cost of food for older adult centers. I don't know how many of you know this, but funding for DFTA is at less than 0.5% of the New York City budget. Think about that and think about the numbers that Eli was just identifying. Okay, there's a total mismatch there. So we think that immediately the new mayor coming in should be tripling the amount of money that goes into aging services, which still would only take us to 1.5% of the New York City budget. So we're not even being, I think, unreasonable here. I think we're just trying to get a base level that can address the increased cost of food, the increased cost of transportation, when we're doing Meals on Wheels, et cetera. I mean, you got to get the food from A to Z, right? And then talk about our staffing and how we can have a strong labor force. Think about the caregivers, both the unpaid and the paid. Thinking about family caregivers, because they are the backbone of our long-term care system. Without them, it would drive so many more people into not only Medicaid, but institutional care, and we know Medicaid is the #1 payer of that. And believe me, I'm a big proponent of Medicaid, but I understand the pressures on government at all levels with that. And so when you think about that, it would cost $10,000 a year in services to keep someone in their home, correct, Anderson? And yet we're talking about $150,000 if they end up in a nursing home bed being paid for by Medicaid. There's a disconnect on basic math. This is basic math.
So I'd love to jump in. So I think that when we look at the mayor-elect's agenda, it addresses a lot of the issues that do impact older adults. He's talked about free buses, he's talked about grocery stores, he's talked about freezing the rent. When we look at our true cost of living report, those are the very things, with the exception of childcare that is not included in there, but he also wants universal childcare. Those are the things that are the drivers of expenses in the city of New York that are keeping people from being able to live with dignity. My recommendation, and I think it's the recommendation of a number of the transition people that are here, because Murad's on the transition team, so it's Wayne. So I'm glad they're going to have their opportunity to have their voices heard while we're all having these meetings, is that we really do need to look at those agendas from an aging perspective. We currently have a number of services in the city, Fair, Scree, we were talking about that a little bit earlier, and people just don't know about them. So some of it is, how do you figure out how to put money where your values are? Absolutely. But some of it is, how are we communicating the benefits that we already have in the city to an aging population? I know you want to jump in. Go
Just
for
back
it.
to that data matching and universal entry, right? That My Portal, really, I mean, there's so much opportunity there. Why is somebody eligible for SNAP who probably is eligible for Medicare
yes.
Savings Program, but they have to go through hoops to get to each one? It's crazy, and we don't need to have that. And that not in this society that we're living in. We're still doing benefits retail, one by one by one by one. Have we not moved into the wholesale level? I mean, really.
And to be honest, that's going to become harder, right? So we all understand that Medicaid was taken over by the state. The city only was left with disabled, aged, and blind, which will not have the requirement of having to work. So we do have to put pressure on the state to make sure that those data matches are happening, so that we're taking advantage of every possibility. But Medicaid cuts and work requirements are another piece that are going to be particularly hard on older adults.
And I do want to jump in as well because we put together the Age Strong New York State and Age Strong New York City campaigns that started last year. They're hopefully 5-year campaigns to transform how both the state and the city operate in the aging space. It's about affordable wellness for nutrition, affordable housing, and affordable community space. I talked a little bit about the affordable wellness with needing more funding for food, but I do want to talk about housing here. I'm glad that you brought up SCREE because SCREE is one of the most incredible ways to freeze the rent that we've ever seen. It actually is a rent freeze program. So it's one of the things that on day one, you could actually freeze the rent for thousands of New Yorkers, but it just requires investment. And that's the one thing we're pushing for because it would be one of the best ways to keep people in their home is to prevent them from being kicked out of their existing home. We're looking to expand that program too because I don't know if you know, but SCREE goes into effect the day you apply for it. It's not something that says your rent is frozen at 30%, and most people only apply when they're in dire straits. So the SCREE program actually sometimes freezes people in an unaffordability crisis. So there's a lot of ways where we can actually meaningfully freeze people's rent on day one by expanding the SCREE program and committing funding to it. Also, housing development, we only built less than 750 senior units last year. 750. I mean, how many older adults were in the city? What does the data say? Million? 1.6
1.4 almost
1.4 million?
Yeah.
And our data shows that 79% are in the lowest 2 income brackets. And the income brackets don't even go low enough to show people who are only getting Social Security. So like we are talking about a population that is in dire need and has almost no resources, and we're building less than 750 units a year. This is something that we have to really look at. You know, we have to make sure that the conversations about older adults are front and center because again, older adults affordability crisis has been happening for decades. Like we're seeing what happens when you leave a population in this situation for a very long time. And older adults can weather a lot, but once you get to the point where older adult homelessness is growing 3 times faster than any younger demographic, there is a crisis that needs to be met. Our campaign goes into, you know, more funding for food, more funding for community services, case managers, because honestly, we're not going to be able to reform the entire federal system in a year. So we need to have the city take things on so people aren't on the streets and so people can survive. And there's also one other wonderful thing I want to say about the New York City system. Older adult centers serve communities. They don't serve specific populations, which means it doesn't matter what your status is. It doesn't matter where you come from. All that matters is that you're an older adult in New York City. So there are services that are already available to everybody. And honestly, I think that since older adults themselves have been overlooked, sometimes the service models have been overlooked. Because I don't see a service model as inclusive or as effective as older adult centers and the services they provide. And it could be something to think about how we serve everyone in the city regardless of age. Because there's a lot of ways to open your doors to people that don't require any kind of documentation and that are quite, you know, uncontroversial. And that's what our network does every day. So for us, I would encourage you to look at the Age Strong campaigns. They're very detailed. They do ask for the $1.5 billion Beth was talking about, and we would love to work with the incoming administration on making sure that happens.
I do want to jump in on housing, though, because I completely agree with you. But there's also a group of unseen older adults that are actually homeowners. Yeah. And property tax is just crippling. So at United Way, we support about 400 pantries across the city. And what we're seeing in neighborhoods where there are owners is that our lines are increasing with older adults who are like, if I have to pay this property tax, I cannot pay for food. So I do think that in order to avoid like that effect of homelessness, we also have to do something for homeowners in the city who are paying property taxes that are just crippling.
So we all know that a budget is not just a fiscal document, it's also a moral document. So in the first 100 days of the mayor's being in office, he's going to have to put out his preliminary budget for the fiscal year. And something I'm always amazed by is that there's never money until an elected official, until the executive wants something to happen. They find the money somehow and they'll balance the budget somehow. So as Murad said, even before the current federal administration came in, there was already a disinvestment in social services, in healthcare, in all the services that we're talking about, ensuring not just older adults, but all New Yorkers could thrive. So we can't have this language about fill the gap. And we know there's going to be a need to fill the gap. We know there's cuts in Medicaid that are coming, and that will affect not just older adults, that will affect people with disabilities, that will affect a lot of folks across the generations. But what we also do know, and to go back to the budget, is something that Live On talks about, is that there are more older adults in New York City than there are school children in New York City. But about a third of New York City's budget goes to New York City public schools, which makes sense. I'm not saying take money away from schools. But why don't we see a comparable investment in older adults? By the way, I just found out earlier in the green room that you become an AARP member at 50 years old. So Grace and I looked at each other because we might have had major milestone birthdays this year, and then and then Beth handed us a membership form. So she's doing her job on advocating for consumers. But I think I joke about it, but it's true. We are all aging right now. We are all aging.
If we're lucky.
If we're lucky.
If we're lucky, yeah.
If we're healthy, if we have social support, if we have, whether it's friends and family, if we are not isolated, if we have access to medical care, we have opportunities to age. And that's where we have seen some promising starts, whether it's the state's master plan on aging, whether it's the cabinet that was brought together here in the city. But what are we really going to do to pull everything together? Because it's not just about the Department for the Aging's budget, which Commissioner Cortez Vazquez, just based on force of will, can get things through and get investments. But that's one person. So what can we do to make sure that HPD is really subsidizing true, deeply affordable housing? What are we going to do to make sure DSS and HRA can expand access to public benefits? We know about 20% of community members served by CPC are most likely going to lose SNAP benefits. If the Medicaid cuts go through, we're talking about 75% of our home care recipients are going to lose home care. So we need to see investments in all these services. They have to be deeply affordable and they have to be equitable. The Asian American community is 18% of New York City. We get less than 1.5% of all social service contract dollars. There's comparable stats for the brown community, the black community, LGBTQ communities. So we need to make sure that these services are streamlined, not because we want more people on services, but because it means that more people can get access to food, more people can stay in their homes, more people can stay healthy and live longer lives.
Just to jump in on that just real quick, is that the social service network that we have built in New York City is probably the best dollar for dollar investment you can make generally. But in a time of crisis where SNAP is going away, where services are going away on the federal level, the network already provides those services. They already are able to float people if they are not able to get food through SNAP through, congregate meals, through home delivered meals. If SNAP does go away for a large portion of people, there's a lot of ways we have with relatively small investments to ensure that people are not going hungry. We just need to make sure that people are paying attention to it and that you can put your money where your mouth is for it. Because honestly, if you care about feeding people at the end of the day, we have a way to do that. I can show you the way to do that. Wayne can show you. My members are in the audience. We can all show you how to do that.
Well, go ahead, Murad. Yeah.
I was just going to jump in really quick. First, you don't need to, wait to join AARP because I'm a member.
He's just rubbing it in that
I'm just
he's
saying,
the youngest person here.
I'm just saying.
Add it to your wallet, no less. It was like right
Yeah,
there.
of course. Yeah. No, they have an app. It's like really easy to become an AARP member. You should do it. I think the other piece here is we need to think about, for the incoming administration, how do we make applying a universal benefit application so that you're not doing, the 1,000 applications. I know some of them are state and some of them are federal, but how do you create one application? And then also stop waiting for people to come in, go out, hire a PEU system, a PEU team, a CAU team. Every agency should be having outreach staff who are going out and meeting people where they're at. And making sure, when I say universal, I mean universal for everyone. Regardless of what your immigration status, we should have benefits. We already have services, as was mentioned, for older adults. But how many people know that anyone has access to it? Very few. So I also don't think that what any of us on this stage are recommending is that filling the gap is going to make us whole in this moment. And I want this mentality of like scarcity to go away at this point, because that is what has gotten us into this moment and why we continue to fight for crumbs. So we need to start thinking about the investments we're making as if the number one investment and the number one asset in New York City is its people. And when you invest in New Yorkers, the rate of return is 1,000-fold. So we have to start acting that way, right? We need to stop making believe that people are going to just be okay because, I think free buses is great, but that's not going to help someone get food on their table. It's going to help them save that $2.90 and $3 come January 1st, but it's still not going to really provide that material conditional change that people are looking for in this moment. And we have to start bringing people in so that they actually know what is available, but also making sure that every new housing development has a quota for, low income, median income, and then senior housing in every new development, so that we're thinking about it. How can we build upon what we are doing, but also where can we add more folks into the system? City FEPS. This current administration that is in right now fought tooth and nail to stop the expansion of city FEPS. And I know it's a huge cost for the city, but it's worth it. You're keeping people housed. What is more important than keeping a family to have a roof over their head, so that we don't have an additional kid who is living in shelter? The city has the highest rate of children right now in shelter systems, but it also has the highest rate of seniors in the system right now. So when we're thinking about this, it's how do you keep as many people housed as possible? How do you get more housing for people who are housing insecure? And then how do we ensure that we are building the city that we know we all deserve and that our communities need desperately?
Yeah, thanks, Murad. I think you've all painted a picture of a much bolder vision for integrated older adult services with investment to back it up. And I'd like to spend a little more time than drilling down on what maybe some of the other specifics that should fit into this vision, because there is a big vision here, and I think it's important that it meets the scale of the need. And as Beth mentioned, our research showed we're talking about with DFTA, a half a percentage point of the city budget, but for a population that is 16% of our city and growing rapidly. But there are a lot of details to be worked out in terms of, what other elements of a vision for financial security for older New Yorkers? What else needs to be on the table? I'd really appreciate your point, Rod, about awareness of existing programs. That same survey that I mentioned found that 20% of older adults had no idea about a single older adult service in New York City. And arguably, in some of the folks that I've talked to, the service providers, they say, I think in my community is probably higher than that. But that is a baseline. We're talking about hundreds of thousands of older New Yorkers that aren't accessing services and are saying we don't actually know that any of these services exist. We also know that from senior centers, I think there's a similar challenge where, only about 1 in 8 older adults has ever actually taken advantage of a senior center. So the vast majority of older adults in New York City, they're not going to senior centers, older adult centers. And so there are some big gaps in terms of just accessing services that we have, right? But you've also brought up a lot of different ideas around, what are the other pieces of an agenda to help address these challenges? And I actually want to spend some time on some of the positives here, if you can call it that. And I'm channeling Beth, and maybe in particular, it wouldn't be right to have this conversation and have it only be framed around these negatives. One of the potential positives, although as Jonathan mentioned earlier, there's a lot of challenge embedded within this, is work. The fact that so many older New Yorkers are working certainly out of necessity after 60 and 65 isn't necessarily in of itself a good thing. But it does speak to New Yorkers living longer, healthier lives than ever. As Beth mentioned to me the other day, finally, life expectancy is back on the rise in New York City, having fallen in the pandemic. We can all potentially expect to live longer than our parents, and certainly than our grandparents, in many cases by decades. Well, one of the things that kind of flows from that is the need and even the desire to work longer, but there's some big challenges to achieving that. Another potential positive that we've written about at the Center for Urban Future, we, I think still to this day, are the only organization that's published an entire report about encore entrepreneurship in New York City, older adults and folks in their 50s and 60s turning to entrepreneurship for the first time as older adults. And that portion of the population has really been booming. There are now nearly 50,000 older adults in New York City who are self-employed, a record high. And that number is growing significantly every year. So I mentioned these things to say, look, that's the income side of this equation. I say this because I genuinely believe there's actually some opportunity there. But by the way, that same survey also showed that nearly a third of older adults want to volunteer, but aren't really sure how, So I want to kind of talk a little bit more about realizing more of these opportunities, but let's focus on the income side of this. And Wayne, I'll turn to you first, because one of the data points that my colleague Rachel found that really stunned me was the number of Asian older adults who are working has doubled in a decade. That is the fastest increase of any population in New York City. And you all run workforce programs for older adults. Frankly, some of the relatively few programs that offer those supports specifically for older adults in the city. So help me understand a little bit more about if the next mayor wants to do more to support working opportunities for older adults, to make investments in workforce development that actually work for older New Yorkers, what should we be doing?
So that's something that we've actually seen as a gap in the affordability agenda of the mayor-elect, is that there's been a lot of discussion about affordability, but the other side of that to get income is around workforce. And, right now there's a New York City Employment and Training Coalition conference that some of us are going to be running back to after this forum. And we need a true senior employment system here in the city of New York. There is a federal and a local senior employment program. CPC does have a senior employment program, but it's only for 150 older adults. They get paid minimum wage, and we do the training, and they get placed at companies. So it's very similar to summer youth employment programming. But imagine you're 65, 70, 75, and you're earning minimum wage, and you're compensated for your work, which, by the way, this is one of the programs that was paused during the shutdown, so they couldn't work, and they're not going to be expanding the program or increasing the investments. So we already seen that the workforce development system in New York City is a very fractured system. We know there's companies here who try to do their own systems. Us, as on the social services side, try to do job development, but we need to place the workers somewhere. So there is a true opportunity. If you want to talk about affordability to the income side, we need to make sure there are more job training programs. It's in a language that is reaching the immigrant adult population that's the fastest growing, to make sure that employers are being held accountable to employing local New Yorkers across the age spectrum, so there's not discrimination. And we need to make sure for those of us who are providing these services are funded to do so. It's easy to say, hey, here's some volunteer opportunities, or we have New Yorkers who want to give back. But as a social service organization, who's going to be coordinating the volunteers? Who's going to make sure there's volunteer projects? Who's going to make sure it's not just about showing up one day to hand out food on Thanksgiving or one day to paint a classroom at my daycare, but it's more about making sure that we have staff, we have the capacity, it's a good experience, it's a meaningful opportunity to gain some skills, and hopefully it's marketable skills and employable skills so they can go back into the workforce.
Yeah, I love that way. No, Beth, feel free to jump in.
Yeah, I think this goes back to the root is ageism, right? And I think we have to keep going back to that. Now, AARP has a program about age discrimination in the workplace, but also to encourage companies and governments and others to sign up to be best employers, that you will give older people an equal opportunity to apply for a job as you would give anyone else. People hear that and go, what? Well, we surveyed people 45 and older, and we found that people in their 40s and 50s were feeling age discrimination just as much as older adults. So, it's coming for you. No matter how old you are, it's coming for you. So I would say one of the things the mayor might want to do is declare that New York City is a best employer for older adults, because in fact they are. Right? They should be taking credit for it, and I know that going forward it's going to be even more so. But also there are other ways. When a new employee comes into New York City, and they learn about diversity and they learn about equity, how much is the lens of aging and ageism in that diversity, equity, education for new employees? So there's many ways to be looking at this, that New York really is the model and could be an even grander model for it.
Go ahead. No, I mean, one of the things that I think is important for us to look at, and I love that some of our workforce folks are here, is adults learn in a different way. And I think that the skilling up to make sure that folks can stay with their employer is an opportunity for us to really encourage adults who want to work to stay there, but we have to make it possible to scale them up. That is one piece. I love the fact that you mentioned that there are more older adults who have their own business. There are models around the world on silver economic opportunities where SBS could give loans to small business owners, right, that are older and benefit. So I do think there are a number of opportunities that we could take advantage of while we're thinking about this incredible resource that we have in the city.
Yeah, and I just want to say, for a framing perspective, like there are a lot of professionals who want to get back to work in spaces like the government. I want to give the Department for the Aging credit for working to bring city workers back into the fold if they need to be there, because there's a lot of talent that is beneficial. I think a lot of times when people talk about older adult employment, they come from this perspective of how do we make this group of people work, and there's an ageism to that. And I think that perspective can shift even, because there's a lot of folks, I mean, there's a similar thing in the immigrant community where you have people move here who are talented professionals who can do anything that, you know, better than a lot of folks here, and then they can't get a job because it's not recognized, right? Older adults have a similar sort of thing where, you know, people are professionals for 40 years. They leave their job for whatever reason, and then they're in a workforce where that experience is just completely and totally not worth anything. So I think we also have to start by shifting our perspective to say, like, there's a lot of talent out there. There's a lot of value out there. And we could be amending our governments and our businesses by proactively including that talent.
Yeah, I would just to quickly add, I think we haven't really talked about the systems that care for older adults. Like, in this moment, you know, I see folks in the audience who have been struggling to even find and work with home healthcare aides, right? Like, that has been an ongoing issue. And where the stopgap came in to support that industry was through immigrant New Yorkers who stepped up. And now, as people are losing their status, we're going to have less of those workers available to care for our seniors and our elder New Yorkers. And at the same time, communities that have had really bad health outcomes historically, even if we have a higher life expectancy here in New York City because of how healthy we are making the city, Black and brown communities still fare worse than other communities. So I think we have to also think about the ways in which, working with local community health centers to make sure that we are seeing what's happening on the ground, and specifically community health centers that are doing the really impactful work. I see our Somos healthcare folks here, but making sure that we have the opportunity to partner with institutions like that to see what's happening in the Bronx, right? Where the health outcomes are increasing in the positive direction everywhere, but not there. What's happening there? How do we work with our folks on the ground to bring that up? How do we make sure that, the North Shore of Staten Island is also getting its own health perspective, so that we're understanding while we want the collective of New Yorkers, especially our seniors, to have better health outcomes, because that's for the betterment of all of us. But how do we do it in a way where it's very hyper local and then collectively brings up all the communities at the same time?
Yeah, well, I definitely want to ask a little bit more about some of the specifics around care. Wayne, maybe I'll turn to you first, but it's really striking to me a couple of things. One, obviously, what Beth was saying earlier, that when the city is able to help folks age in place, among many, many benefits, social and emotional benefits and long-term, health benefits, there's a fiscal benefit, right? We're talking about a $8,000 or $10,000 investment versus $150,000 for a nursing home bed, which we may not even have. And home care is a huge part of that. And I guess I want to ask you a little bit about, with maybe some of that framing, because you all have sketched out potentially a $1.5 billion agenda here. And there are some difficult realities. Wayne said, obviously, when City Hall prioritizes things, the money can be found. Revenues may come in suddenly higher than expected, but there's also a reality that the mayor faces. The mayor is required, as Wayne has said to many Coro alumni over the years, to balance the budget, not a fact that necessarily folks know in the advocacy world. And it's not the same case for the governor or for the president, but this mayor does have to do this. So with these constraints, understanding that we're going to be seeing, we have a structural budget gap in New York City. We've got potentially big challenges coming from federal cuts. There's also a lot of costly items in the mayor-elect's agenda that he's going to want to pursue, voraciously. And then we're talking about a lot of new spending here. So the reason I'm bringing this up is maybe help me understand, what is the fiscal case for some of these specific things that you think we need to be doing? Meaning, if part of the argument has to be, well, we don't want to approach this with a deficit mentality. We want to have this sort of abundance mentality. We don't want to be asking just to fill the gaps all the time. But the mayor-elect is going to be inheriting a really difficult fiscal situation. That's even maybe understating it. You know, a massive multi-billion-dollar budget gap that's about to get worse. So I guess I'd love your help kind of thinking through, first of all, is there anything we're doing right now that we're spending money on that doesn't make sense, that isn't the right approach? Is there anything here where you think, look, the case is at least in part that we need to be investing in X, Y, and Z because there's a really good return on that investment. It's the right fiscal thing to do as well as the moral thing to do. And I'd love for all of your thoughts about, given that I know that the mayor-elect is going to be facing these issues as much as it would be, you know, much more politically advantageous to simply say, look, we just have money for all of these things, but how would you advise them to help think these things through? And sorry to be looking at you, Wayne, but I can start with you. I'd love everybody's thoughts.
I also do advocacy, and I've never asked to cut something, so it's an interesting thing. So let me go to the actually budget reallocation and then what to invest in, especially on the care side, the care economy. So if we look at the city budget, and we can get into drivers and conditions, but the main thing is that if we're looking at being fiscally responsible and having a balanced budget for the city of New York, right now, NYPD overtime is about $4 billion a year. Department of Sanitation overtime is in the billions. There's one more department, I forget, Grace needs to help me out. There's one more department that their overtime is about $2 billion a year. Corrections, right? Thank you. So right there, we're talking about $10 billion out of our city's $125 billion budget, $130 billion budget. And the social services contracts every year only total $4 billion in the city of New York. The contract that goes out for education services from the Department of Education is about $4 billion a year, total. That's daycare, that's after school programs, total. And then we've already heard the numbers for NYC aging. So yes, we all want a safe city. We want to make sure when there's a senior walking on the street, there's not violence. We want to make sure that when there's folks getting on the subway, that we don't want to see people who are unhoused on the subway, and not because we want to criminalize poverty, but because we want to make sure everyone can thrive. But if we're going to make decisions, what are we really going to do around carceral program? Are we investing in carceral programs that we know are not leading to that return on investment? Or are we going to invest in the services and supports that, again, get people out there? So whether it's investing in childcare, because we know if someone has their kid being taken care of, that they're also able to work, but that also means that the daycare provider, whether it's a family daycare provider or an after-school program staff, are able to earn an income. And we need to see that on the older adult side. So Murad has mentioned home care. Home care is mostly funded by Medicaid, and we know there's cuts coming. And during a time when there's more folks who relied on home care so they can age in place, it was really immigrant New Yorkers that stepped up. And many of these were TPS, many of these folks are here, and you got to get cleared to work under Medicaid programming. So they're allowed to be here, they're documented, and they're taking care of each other. But that's where we need, because we are one of the steering committee members of Fair Pay for Home Care campaign, home care workers used to earn minimum wage. So it used to be $9, as you all know. But now home care workers earn more than minimum wage, about $22 an hour. It's still not enough to having a living wage, and that's why we're ultimately working towards a living wage for home care workers. But we need to make sure that we're not just supporting home care clients, we're supporting home care workers. At our affordable housing buildings, we know we're providing housing not just for the seniors that live there, but every day their home care workers come to take care of them. But we also know they have a roof over their head because in the Asian American community and immigrant communities, there's high rates of overcrowded housing where you have multiple families living in the same home. We also know at our older adult centers when home care workers are escorting the clients to come in. And by the way, yes, there's been an investment in older adult centers. We still have a wait list of thousands trying to come to CPC's 4 older adult centers. So we need to invest in the care economy. We need to make sure it's not just about paying our home care workers more. We know as folks are living longer, they're going to have around-the-clock needs. And while there's 24-hour home care, you can't have one person in the home for 24 hours. You should split them and have 2 workers that can work 12-hour shifts each. And we need to make sure we're investing in our workers to provide these services. It's not just doing fully funded services. It's making sure that we support campaigns like Just Pay for human services workers that Human Services Council has been leading, supported by organizations like United Neighborhood Houses, Immigration Coalition, Live On, and others, is that we need to make sure our human services workers are earning a living wage, because 40% of nonprofit human services workers, because wages are dictated by our contracts, actually receive public benefits. Yeah. So we have human services workers that work at our senior center and then go around the corner and make sure they're renewing their public benefits through their colleagues. And that is not a way for us to have run social services and supports, which are so critical for everyone to not just survive, but thrive in the city.
Yeah, I would just add really quickly one thing that the city can do that will save them an enormous amount of money. And it's not cutting anything, it's actually increasing pay. So Just Pay would help people on the economic upward mobility so that they're able to get off of benefits if they don't need them anymore. The same thing with the agencies, right? One, don't ever take money away from sanitation department. We all love them. Everyone else can get cuts. Just kidding. But if we pay city workers more, right, then we're going to have more people wanting to work for the city. And if we're paying people more to want to work for human services, they will want to work for human services. I think we're putting people in really impossible positions. And then when we were seeing these overtime numbers, which is insane, right? Like if you're having these overtime rates of $4 billion at PD, $4 billion here, like that in itself is saying 2 things. One, there may not be enough workers. Right? The second piece is maybe people are trying to earn more because the cost of living is too expensive here. So we're solving for the thing by ensuring that it's going to be an opportunity for people to see, well, the pay is actually good enough for me to work for the city. And I think that's the other piece here that's missing, is you can save a lot more by investing more at the forefront, so that you're not having to catch up down the road.
And I do want to.
Oh, sorry, I just saw Beth's hand up, and then I'll come right to you.
So
back to you, Kevin. Yeah.
I'm going to go back to the supply side, because we all want to be responsible financial stewards, right? So if people can't afford to stay in the city, or people can't get the care that they need to stay in the city, then they're going to leave. And we know out-migration is a problem, but let me tell you folks, out-migration of older adults who are paying real estate taxes, who are getting their Social Security checks and their 401ks and their pension, and they're going to the local shops, bodegas, dry cleaners, you name it, they are an economic driver of the city. The longevity economy is something that people don't talk enough about, and it generates billions of dollars for New York City in economic stimulus. So yes, we're all been talking about the need of lower income people, which is really important, but we also have to think what you were saying, Murad, about going back to the care workers. If you're a middle-aged worker in New York City, if you're a daughter who ends up as the caregiver, right, for her parents, and you're worried that mom is going to slip and fall because nobody's there, or you're worried that mom can't get to the doctor, or mom needs to get her medicine administered, what happens to you in your work? What happens to you as the family caregiver? We have data that shows that so many are now leaving the workforce because they have to take care of their family members. Again, not enough care workers out there, but also because they lovingly want to take care of their family. But at the same time, many of them are working less hours. And what are we doing now? We're creating a cycle, back to what you were saying, of when it gets to their retirement age, they're not going to have those 40 quarters in possibly. They're not going to be able to have put enough money into their 401ks. So we're building the next generation of people who are going to be in need. Why? Because they're helping people age in place, which I don't know about you, but for me, for sure, I don't want to go into a nursing home if I don't have to. There's a place for nursing homes, but all of us, I think, want to live in those homes and communities that we built. And so we need to make sure that that happens because it is the nice thing to do, but it is the fiduciarily responsible thing to do. We need their economic stimulus.
That's a great point, Beth, especially getting ahead of retirement in that way. But folks are not able to save that money up front or be eligible for Social Security because of the care demands. Kevin, I do want to come back to you, but given where we are on the clock, I want to get it over to our audience for a minute. I'm sure there'll be questions that you can jump in, and maybe it'll give you a chance to get your thoughts in. But let me turn it over to the audience. My colleagues have microphones, so please throw your hands up. We'll start in the back because I just saw that hand up come up first. Let us know who you are. Please keep your questions brief, and we'll get to as many as we can.
Good morning.
Thank you.
Michael Augmenti, First Deputy Commissioner, Department for the Aging. I want to thank you all for this conversation, for citing our survey. Megan is here, for mentioning ageism. We just started a campaign on TV. I saw it on Jeopardy last night for recognizing commissioners' force of will. My question is raising the retirement age. Is it a bad mistake or is it a blessing for those that are going to have to work a little bit longer?
We should lower
Are you
it.
talking about the next iteration of when they've got to solve for Social Security at the federal? Is that where you?
By raising
Yeah.
the retirement age.
Yeah. So there's a number of things that are going to have to be done. I think everybody knows that 2034, everyone here will be taking an 18% cut on your Social Security check if they don't solve for the long-term security of Social Security. Choices are going to have to be made, and there are a number of levers that can be adjusted. One of them is to extend the work age. And that might work if you're sitting at a desk in your home or whatever. If you're out there on the garbage truck, right, that's not such a good thing. So there are gives and takes to this. There's also the opportunity to raise the limit of how much people put in. Right now, there's a percentage that we all pay. It goes up every year. That really needs to be looked at again too. So there's a number of other ones. So we all need to hold our Congress members' feet to the fire to make sure that the best solution they can come up with. And at this current point, they're all in avoidance mode. Got an election year coming up. They're in avoidance mode. So, but Michael, thank you for raising that, and thank you
I
for
would
the work
say
that you
we
do,
should
Michael.
lower the retirement age and allow people to retire when they want to, and if people can't, then they don't. But I think that this is like another trap that the federal government is putting people into, and it's like moving the goalpost all the time. So we shouldn't be entertaining doing that in a sense where the people who are now going to potentially be able to benefit from Social Security, who haven't really, who paid into it, we're saying, okay, just wait 5 more years. And I think that also is harmful to communities. But if people want to continue to work past, I say bring it down to 55. But if you want to continue working past that, that's your choice. But it shouldn't be dictated by the federal government as they're trying to right now.
All right, thank you. Thank you for the question. Thanks for your work. Let's just see some more hands, and I can see my colleagues as well. So we'll go right here to the front. Thank you.
I'm just going to sit. My name is Anya Aidman. I'm a founder of Aria Energy. I've done a lot of work on economic stability projects in New York City over the years, from Sandy recovery, working with Workforce One, and working with a lot of youth population and building out large ecosystems to support that. Right now, I'm focused on working with I'm going to say AI, but I know it's kind of like, oh no, with artificial intelligence, but more as data sets, right? We were talking about unifying data and streamlining information to the people who need it and when they need it. Has there been any conversations in regards to technology and how technology can actually support hours and hours of case management care? I mean, I've done it myself. I know how long it takes, and it's tough. It's when you're out there, right? So I'm just curious, how does technology play a role in the conversation that we're having today?
Thank you.
I can say that at Live On, our conference is coming up in February. We are working with folks who work in AI to ensure that, there's a lot of stuff happening with it. I can't get involved in all those conversations, but it's responsible to understand how this technology can help us if it's out there. So we are currently exploring, different AI technologies and tools. We're still early on, so I can't give any big, updates on where it goes, but we're working to introduce our members to different sort of technology sets, different leaders in the field to understand how it can be used responsibly. and how to incorporate it in your work. I think it's very nascent in its existence, and I think uptake downstream takes a long time. But we're trying to expedite that as much as possible by opening the conversations and creating the spaces for folks who want to bring AI into social services effectively to be able to bring it directly to social service workers, so that we can hopefully create the conversation needed to implement it effectively. So I'd love to keep that conversation going with you as well.
And as we saw when the pandemic hit, that when everybody had to stay at home, that a lot of what had to happen was accessing and having connectivity through technology. But what we saw was, whether it's due to poverty, due to lack of knowledge and access, is that a lot of our older adults had never used Zoom, virtual learning, cell phones, smartphones, none of that. Everything was always in person in how they accessed food, daily lives, doing their daily activities. And that's why the city council has a digital inclusion initiative. They recently started an AI initiative. We're fortunate to be one of a few dozen organizations that have access to that. So our programs are able to teach our older adults how to use technology that for all of us is very basic. I mean, you see all of us up here looking at our cell phones because we're getting text messages from people during this, but that's not how our older adults have been experiencing things. So we need to see investments in digital inclusion and AI programming for older adults. And we've all talked about advocacy. A lot of this depends on advocacy. And it's important to note that older adults are the biggest voting population here in New York City. And something that's always surprising to me is that when it's an election year, we see candidates want to come to our older adult center all the time. But whenever we're figuring out the budget or initiatives or programs, then for some reason they forget about older adults. Not the elected officials are here. The elected officials that are here are awesome and always show up. And but I think that's something we always need to remind folks, is that older adults should not be looked at as a deficit. We need to look at it as an asset. And whether as workers, whether as contributors, but definitely as voters. And Live On and AARP have been publishing a lot of data about the high percentage by borough, by neighborhood, by district of older adults who vote in New York City.
Thanks, Wayne. Sophia, if you got the microphone, just take a question right from the front row here. Thank you.
Hi. Chris Neal, I'm with the Office of Talent and Workforce Development. Thank you all. This has been a great panel. I have a question about employment for older adults. So as I think you all know, the programs that are dedicated, workforce programs dedicated to older adults are pretty limited in number and budget. So it seems to me that part of the solution, at least, is to help make some of the programs that exist that are more for general populations more age inclusive, more open and inviting to older workers. And I would love your comments about what programs can do to be more inviting and accessible to older adults.
I'm happy to jump in. So we talk a lot about language access. There's also access of information for someone who learns at a different level. And I think that's where we kind of fall apart. From a government perspective, everything is still very much in like these legalese terms that are not accessible. I don't know how much outreach we're doing where older adults are in our senior centers to let them know what is possible. We just need to get better at getting information out there in a way that makes sense. But Chris, I'm so glad you're here, and I know that we talk often about how we have to change the workforce in New York City. But as I was sitting up here, I'm like, we have a whole SYEP program, right? We don't have the same level of investment or the same level of campaigning on the few investments that we have for older adults. I think there are things that we can learn from other communities and how we've done it to include older adults in that conversation.
Hey, thanks for the question, Chris. Other hands, we'll go to the middle here and then over onto the right side.
This young lady over here has had her hand up for a while, so I can go after her.
Oh, back row. Sure. Okay.
Hi, so I know we've been having a conversation about affordability, but what I haven't heard in this conversation is how are you guys working to get reparations for older adults? Because like you said, there's a cycle that keeps being created, but it all stems from Black and brown adults not getting, or rather generations not getting reparations. And not only that, but how are you gonna hold not only the mayor, but the governor responsible for the housing affordability for our seniors? Thank you again.
I do want to say a piece on that because we do a lot of work in ageism, and I think that when you look at ageism and you look at racism and you look at a lot of different discriminations, they compound over the life course. And then once you hit 65, it just gets worse. So it's definitely a situation where ageism compounds the existing discriminations here. And I think Livon has always been very vocal and active in calling that kind of discrimination out. We use that language when we talk to leaders who are being ageist because it's important to say directly to them, hey, this is what your actions are. You have to deal with the consequences of that, and you have to work with us on that. I think the best way that we can work with our network and within our realm to answer those issues is to ensure that the communities in New York that haven't been served start getting served. Because at the beginning, the first thing we need to do is to make sure that folks in communities that have been disadvantaged over time can eat and can have housing and can stay where they are and don't get displaced either to different places that are cheaper or to the street. I mean, the conversations about displacement always talk about people leaving the city, but a lot of displacement is from your home to the street. That's a real kind of displacement. So I think that, there is the intersectionality here of like a lot of ways to deal with these fundamental issues starts with making sure people have their human needs, because we have to make sure people have a foundation so that we can start fighting for more and start fighting for justice. Because at the end of the day, if you don't have a home, it's hard to find food. If you don't have food, it's hard to think about your next steps at work. If you don't have work, these things are compounding. So for us, it really is build the foundation, make sure folks aren't worrying about their next rent payment, their next medical payment, their next bill payment, and then, start talking about what justice means beyond that.
I'd also like to remind us that we do have a platform to have that conversation. There's a racial equity commission at the city level. There's a reparations commission at the state level. And when we talk about the whole of government being involved, is looking at it from an aging perspective, right? How do those two commissions be an asset for us to discuss it from what does it look like for an aging adult who is Black and brown, who is a part of the LGBTQ community, and why is it so much worse? So we have these platforms. We just need to hold the folks in those platforms accountable.
Absolutely, because it's taking too long. Like, it really is. And I'm already 42, and it's like, how much more do I have to keep fighting to end generational homelessness? Like, how do I have to keep telling y'all that the stresses of this system is breaking my husband down from the MTA because you don't want to give him more money, but you also don't want him to be outside picketing. Yeah. Like, we got to get this together already. Like, enough is enough. Like, we got to really have a real serious conversation or bang down somebody's door. Like, Kathy Hochul has to come outside.
All right, well, thank you for the question. Thank you for the thoughtful responses. Unfortunately, that is all the time we have for this amazing first panel. So if everyone would join me in a round of applause for our panelists. Thank you all so much for your thoughts and ideas. I really appreciate it. Thanks. But don't go anywhere. We're going to move directly into our second panel. I'm so thrilled to welcome our two elected officials up to the stage.
It's so good to see you.
Councilmember Sean Abreu, gentlemen, welcome. And folks, please come, take your seats. If you are in the back, there's some seats in the front. Come on in. I'll give you a minute just to come in, get a little closer. I'll keep it down in the back, but please come join us in the front. And Borough President, I'm a little biased here. I'm a proud and longtime Queens resident. So if you're wondering why most of my questions are about the intersection of Hillside and Jamaica Avenue, now you know why. No, I'm going to hold back. I'm going to hold back on my Queens agenda.
I grew up over there.
we could talk. Let's talk Richmond Hill offline. But I did want to start with you, Borough President, and in part because our data that we referenced earlier shows, folks, if you could please keep it down in the back and come and join us, we'd love to have everyone come close. Thank you. And again, to all those folks that are tuned in online, thank you for sticking with us. We'll try to get to your questions online as well. They've been piling up as we've been talking. But Borough President, let me start with you. Among other things that we shared in the data earlier, Queens is home to more older adults, than any borough. The fastest growing segment of our population in Queens as it is citywide. And I guess I just wanted to start with what you're seeing on the ground. You probably more than anyone in Queens, you're on the ground in every neighborhood, constantly. But when you hear from older adults personally, when you talk to the service providers across the borough, what do you see that reflects this affordability crisis? What do you see when it comes to the impact of financial insecurity on older adults today?
Well, I'll say the rent is too damn high, and property taxes are too damn high. Water bills are going up. Light bills is going up. Matter of fact, even for me, I've told my son we're going to unplug the clock at night because you can't tell time in your sleep. But that's a Chris Rock joke, by the way. But in all seriousness, as we get to the older adult centers, we really are seeing people struggling. Queens is home to more than 400,000 older adults, and this crisis is of a mass epidemic. We're having older adults who saying we have to leave this very community and very city that we've loved, that we've given everything to, that we've worked. We're going through our savings. Social Security is just not enough. So I'm really worried, and we'll talk about policy and things we're doing to address the housing epidemic that we face. But our older adults are being priced out of the city.
Yeah, appreciate that, Borough President. Well, Councilmember, let me ask you as well. I mean, I think maybe a relatively little-known fact about your career is that one of your first jobs was at the Morningside Heights branch of the New York Public Library, among other things, teaching older adults to use the internet, right? So you've been doing this for a while now. I want to ask, now that you've kind of seen the challenges grow and maybe change over the years in your community, uptown, what are you seeing now in terms of the crisis facing older New Yorkers in, Washington Heights?
Well, Eli, thank you so much for having me. Housing is by far the biggest crisis point. In my district, of all the older adult cases, 60% of them are older adult housing cases, totaling almost 60%. Older adults on fixed incomes cannot keep up with rising rents. A report produced by the Center for an Urban Future has found that 60% of New York City older adults have no retirement income besides Social Security, and 19% have no Social Security or SSI at all, and that's the larger context that we see in our office every single day. Older adults are having to fight between choosing rent, medicine, or food expenses. Food insecurity is certainly growing, and we're seeing it in our offices. The lines are getting bigger and bigger at our food pantry that we host every month. And when it came to even just SNAP recertification and HRA barriers, it hit older adults the hardest, especially those unfamiliar with digital systems. So yeah, it brings me back to my library days, the digital divide. I remember when I would work with older adults then, teaching them how to send out an email, right? Or how to use Microsoft Word. Those issues back in 2005, I guess, when I was, actually 2006 to 2010, when I was at the library, are still very much present today. Many older adults that come to my office have no email address, they have no smartphone, and they have no way to navigate HRA, Housing Connect, SSA, or NYCHA portals. And what does that mean? Give you an example. We had a bed-bound older adult who lost Medicaid renewal because the application went to an old address, leading to a lapse in home care services. We had another situation where older adults during the federal shutdown came to our office for help just to download their Social Security award letters. We had another situation where an older adult STAR exemption was denied because her mailed documents were lost and she had no digital option. So with the advent of AI now, right, how can we help older adults figure out these things so that the digital divide is not literally costing them? And so there are a lot of things that we can do here. And, I'm looking forward to tackling that in the next few years.
No, I really love those thoughts, and really powerful to hear those examples, from your district. And I guess, Borough President, let me, you started Councilmember Brady with housing, so let me bring you back in on this, Borough President. I mean, you've been a really powerful housing champion in your time in government, and in particular in your time as the Borough President, and helped deliver thousands of units of housing in Queens. And some desperately needed senior housing. So I guess tell me a little bit more about what's working when it comes to actually building senior housing in Queens. But most importantly, if the next mayor wants to really be a champion of housing or for our older New Yorkers, what should he be doing? What do we need to do more of or do differently to make that work?
Well, I'm very proud of the work that we're doing to tackle the housing crisis in Queens County. Just over the course of the last month, we've approved nearly 30,000 units through two major rezonings. One, the Jamaica rezoning, which is going to shepherd in upwards of almost 15,000 units of housing. And then the Long Island City rezoning, which is another 15,000. And just this past Friday with Governor Hochul, and we were working on plan for about a little over 2 years and had to do a lot of community outreach. Over 400 people participated in submitting testimony in support of this plan to finally redevelop a campus that was untouched for 50 years, and that's the former Creedmoor campus. And on that campus, we're going to develop upwards of 2,000 units, and we're doing a older adult set-aside. So we're going to have SNAP, God willing, who does great work in Queens County, take the ground floor, and then we'll have units upstairs. So we're being very intentional when we are building these projects and ensuring that there is an older adult set-aside. Out in the Rockaways, we're now in the midst of redeveloping a former hospital site, which is known as Edgemere Commons. We're just up there touring the other day. They're going to do a older adult set-aside in those units. So I think the mayor has a lot of room. There's a lot of development happening. Willets Point, which is the largest affordable housing development being built in the city in the last 40 years, there's almost 4,000 units that are going to be a part of that plan with an older adult set-aside as well. So you will see buildings sprouting out. But more importantly, it's not just about building housing. It's also about what services are we providing as well. In the city council, I was also the zoning chairman. I did the first SARA program, which is older adult residents out in the Rockaways. Got a lot of pushback on it, but we also were able to incorporate a nonprofit in there to also feed, right? So they're guaranteed a meal in that building every day, and then they have community center set-asides where they can all congregate together. So what can the next mayor do? There's a lot that the next mayor can do. One, I think we should really relatively look at a lot of our older adult centers, especially in Queens. They're really small, they have to grow, but maybe there's an opportunity to map housing on top of the older adult centers and then expand these centers for use for our older adults. I think the mayor should definitely, and I think he's talked about property tax relief. It's ridiculous how some communities, a community in Southeast Queens is paying relatively 3 times more property taxes than somebody who owns a condo or something in Park Slope. We have to really address the property tax burden that's really impacting communities of color more than anything. I talked about the SARA program. I think our next mayor can expand that. And I think while there's been a lot of work on SCREE, definitely more promotion needs to happen. And I think the city should be relying more on their nonprofit partners and not just saying do it, but providing them with the resources to actually do it. And I think we should get creative with zoning. You know, zoning really unlocks housing. Why aren't we giving developers a zoning bonus committed to older adults? So I think the mayor can definitely think of talking to developers and saying, hey, if we give you a bump and give you a little bit more density, could you do a set aside for older adults? And then the last thing I'll say, and I talked to the governor about this last week as well, you know, she had this faith-based initiative, and a lot of our older adults, you know, still head out to their houses of worship every week. Could we think about getting that faith-based initiative going again, which was statewide, but if we can't get it done statewide, we should certainly be looking at completing it citywide. And the last big thing is food, and food insecurity is hitting us hard. Our older adults are on lines, and I appreciate a lot of the nonprofits who are really doing this in a dignified fashion, who are using technology and helping our older adults to use technology so they don't have to stand on those lines. So really transitioning from that. But we need a real focus on food insecurity, I think, moving into the next administration.
Well, Borough President, that's great. I mean, I think hopefully folks are taking notes. You're laying out a policy agenda quickly and decisively, and I want to bring you in, Councilmember, to maybe share some more thoughts there, in part because, you know, you were a real champion of the age in place package of legislation from last year and have talked about, you know, what needs to happen next. You've obviously been advocating for tenants, you know, for much of your career and advocating for building housing in your neighborhood. So what do you see as next for the council on aging, in particular around these affordability and financial insecurity challenges? What would you like to see your colleagues get behind next year?
Well, Donovan, I also spoke to the governor last week. I actually did not. So I would say that one of the things that I want the next council to work on under Speaker Menon's leadership is to expand, is to lower the SCREE and DREE age threshold below the 62 mark. I think that would provide a lot of relief for our older adults, especially with affordability and being able to age in place, but also raising the income eligibility to reflect actual cost of the cost of living in New York City, which has risen dramatically since the last update. Also, simplify benefit renewal. I think something as simple as that. We need more in-person renewal options, not just digital platforms. As well as employees dedicated to helping older adults navigate the digital space. In terms of consumer protection, I think that's going to be a very big committee and a very big focal point for both Zoran Mamdani, our mayor-elect, and also the former Consumer Affairs Commissioner, Julie Menon. So I expect a lot to be done there. For instance, we're seeing a lot of dynamic pricing that's taking place right now. That's where prices for consumers are changed based off of demand, the time of day, and the level of inventory. So you imagine the inventory is low and Instacart or one of these big companies decide, you know what, let's drive up the price of food for the same item that cost $10 cheaper maybe 10 minutes ago because they had more of it. That's something that the next council needs to really focus on, is eliminating dynamic pricing. You also see situations where a consumer can walk into a store and find that the price of an item at the shelf is different by the time they get to the cash register. We need more oversight and we need more oversight and enforcement on that issue as well. We're also seeing the rise of surveillance pricing as well. And that is where pricing is being based off of personal information, purchase history, and the location on where that consumer lives. Older adults, this is going to be very important as well as it impacts older adults. And we already know that the cost of living is already so high for them, but by focusing on consumer protection issues, we think that can alleviate a lot of the issues. We also have to prepare for the next wave of aging adults as well. And that's why it's important to focus on the gig economy. We're seeing a lot of folks in their 50s and even 60s working these jobs. That's why under my leadership, we were able to pass a bill that provides basic pay transparency. A lot of deliveristas who drop off your foods, they don't even know how their pay gets calculated. They don't have access to their active time worked. They didn't even have pay stubs. They would just get a aggregated amount of how much they get paid, but not knowing how that pay was calculated. And so we have legislation that we just passed that's going to make that better. And there's also the other bill that we passed was tipping transparency, that when you take a delivery to someone's home, the consumer didn't have the option to tip until after you got your meal. Are you going to tip after you've gotten your meal, or are you going to tip at checkout? More likely at checkout. So we have a bill that mandates tipping at checkout, and we believe that's going to provide more earnings for our older adults as well, which is now making up a huge part of this gig economy.
Those are really helpful examples, I think, of some of the concrete things that can help with the income side of the equation. And, President, I want to ask you a little bit more about that. I mean, one of the things we talked about earlier, flowing from a report that the center published several years ago, is we've really seen a boom in older adult entrepreneurship, and in particular in Queens. Folks starting businesses for the first time in their 50s and 60s. And, while there's some real challenges that are driving that, the financial insecurity that folks feel where they can't retire at 65, there's an opportunity there, right? I mean, we're seeing that there's actually more, ingenuity and entrepreneurial spirit in our older adult communities than I think folks recognize. So not just entrepreneurship, but also thinking about work, sometimes very precarious work, in other cases, older adults that feel like, I want to keep working after 60 or 65. But I'd love to hear your thoughts about what more could we be doing on this income side of the equation to help more older adults be able to generate the income that they want and frankly that they need into their 60s and 70s. Do you see maybe some missed opportunities there, or things you'd like to see more of going forward?
Well, I'll say I just was down at doing a update tour at LaGuardia Airport just yesterday. Oh, it feels like last week, but yesterday. It's a long day yesterday. And it was interesting and fascinating. We're trying to create these opportunities in Queens. So between both airports, we've seen upwards of a big boom. JFK right now, we're redeveloping JFK. Upwards of 10,000 jobs, 6,000 of those are union jobs. But what we've done, which is very creative, is we created this program called the IOC. And, it consists of individuals who are older adults, by the way, who may want to who are looking for an opportunity to share their entrepreneurship in the airport. And I just want to talk about this program a little bit more, but it was fascinating being at LaGuardia Airport, like I said, doing a tour and seeing an older adult who had retired, and she's now vending in the airport. So we're looking at creating opportunities like that all across different sectors, because there are a lot of opportunities, as many people know, in Queens, especially around food. Everybody loves food in Queens. You can get a taste of the world and in Queens. So you look at the soccer stadium coming into Queens County, there's a huge opportunity there for our older adults to share their entrepreneurship skills there. You have both, most of you have heard the news about Resorts World, and you've heard the announcement around Citi Field. You're talking about upwards of 30,000 jobs, and there's a little bit for everybody with these opportunities arising. I'll talk about JFK once again. Just getting back to JFK, we created this program called the IOC, and what that enables people to do is literally to come in and learn how to create a business within the airport. What does owning a business in the airport, what does that framework look like? And we just graduated, I think, the 7th iteration of that. And these are really good opportunities. And the key is I think you've mentioned, as people start to look at retirement in their 50s, is to really create these good job opportunities. Part of the big problem we've had is we've had a lot of big development that's happened routinely in Queens and across the city, and people are being paid minimum wage. So creating good jobs very early on, and like I said, these are union jobs. So if you look at the soccer stadiums, if you look at the deals that we've inked on the airport, the casinos, people need pensions. We need to make sure that there's long-term viability with whatever big economic development projects are happening. As we look at human services, there's a huge need, right? I think some of the panelists prior to me spoke on that. With the redevelopment happening, the nonprofit sector always needs assistance. We always need to see more older adult centers being increased across the borough as the population grows. So these are real opportunities. For Miss Fanny, who may want to help out at the food pantry, could we give her an opportunity to work in some of the development that's happening across the county? So I think there's a real opportunity, but I think we have to be very strategic in making sure that we're creating, not just doing economic development, but community development. And I think through these opportunities, I think there's a little bit for everybody to really flourish.
Oh, thanks, Bro President. Well, there were so many hands up for that last panel. I do want to turn it back over to our audience. If you're okay with that, we'll try to take a few questions as well. Let me see your hands again. And I know, sir, we didn't get to you with the last panel, so we'll come to you first. Microphone's coming your way, and we'll try to get to as many as we can.
Thank you, Eli. So my name is William Jourdain. I am the executive director for Woodside on the Move. So got a couple of questions, but first I want to say thank you to Cuff for organizing this forum and putting this together. Last year, during the report that you all put together for the 50 ideas for equitable ideas across Queens, I submitted an idea specifically regarding seniors and expanding vouchers, or at least creating a program where seniors would be responsible for paying a third of their monthly income on rent, right? As we know, they are the most displaced group of folks who, especially within the context of Queens, where over 400,000 residents live, and 14% of those individuals, or over 14% of the seniors, are living below the poverty line. And if you're on a fixed income with these rising rents, there should be a voucher system in terms of expanding what City for HEPS looks like, specifically for seniors. And so I think last year we had a really great opportunity during the City of Yes proposal, where we're looking at the complete revamp of the landscape across New York City. And it's a great opportunity, but we missed an opportunity in including this clause for seniors. So my questions are, one, and I know, Councilmember, you mentioned expanding SCREE, and I think one of the things that we're not really looking at is that actual bracket in terms of income. Seniors who are newly retired oftentimes have to wait years before they could actually get onto SCREE. And so how do we actually streamline that process to where they're not looking at that actual gap within actually being able to receive that funding? And also with HUD, we're seeing at the federal level all these federal agencies that are being critically divested from. And so right now is a critical moment where we need to actually step up on the state level. So I'm going to assume that the state will step up with Section 8. But how do we actually build momentum around that to really get the state to focus more on an actual voucher program to support seniors?
He wanted you to go first. All right. I could. All right. On the state level, I think this room is full of great advocates. I see Sharon Levy in the room too. I mean, it's really about coalition building, right? And I think we have a lot of good people in the room. The squeaky wheel gets the oil. I think we need to really organize around this and really take this to the state level and really push them to do more here. And I think in light of what we see and know is happening at the federal level, and I know, we're speaking with our state partners a lot on these issues, we're going to have to fill these gaps, just without a doubt. So everybody's going to have to do more. I think the mayor-elect is correct. The rich need to pay more. They need to pay their fair share, which would enable us, to really step up resources in these areas. So I think there's going to be a fight on our hands, and we're going to have to fill these gaps without a doubt.
In addition, I would like to add that as part of City of Yes, the speaker had a City for All agenda, and there was a lot of resources that were extracted that we must now hold the administration to account to making sure, we got more money for FEPS, we got more money for vouchers, where there were a lot of investments for homeowners. We just have to make sure that those commitments remain intact under this new mayor. And I have every reason to believe that under Mayor Mamdani, he is very, very focused on affordability. But to Donovan's point, we have to do coalition building. We have to organize and making sure that the older adult agenda is top. It's top, front and center.
Thank you. Yeah, I saw that your hand was up before. So yeah, I'd love to hear your thoughts. Thanks.
Hi, good morning. Thanks for being here. I was really interested in learning more about shared housing opportunities, intergen housing. Yes. I think we're missing a great opportunity when we talk about the high property taxes. We're talking about older adults becoming homeless across the board, right? It doesn't just go older adult or youth. So if you could talk about conversations to use that as a solution or starting a pilot to even track it. There are some programs that already exist in New York City, but I'd love to hear more, especially in Queens, especially where transportation is an issue, how, intergen communities and families can think about sharing resources to address some of the housing issues, affordability issues. We heard a lot about ageism in the earlier panel, and I think that would be a really great conversation. And
yes, and I agree. And I didn't expand on what we're doing at Creedmoor, but we have really been thinking about this very seriously. So out of those 2,000 units, over 50% of them will consist of what we deem as affordable home ownership, and the mother-daughter deal that many people have built up. I think Reverend Flake in Southeast Queens was big on that. Having families stick together, because that the more disposable income you can bring together, that enables costs to be lowered and older adults not to shoulder these costs alone, especially through retirement. So stay tuned on it. We now have an RFP out. If you are an organization, you should certainly be approaching those developers who are going to be developing the site. We anticipate we'll break ground on the site in 2027, but a lot of thought has gone into this actual initiative that you just discussed. So I hope I answered your question, but I think affordable home ownership is key right now because it's really become out of reach for a lot of our young people. And then you have older adults, you have young people moving out, right? Trying to find their own nest. And then what happens is, an older adult is left in the home alone. and they're shouldering this burden. And I've heard these stories where, listen, I'm going to have to leave this neighborhood. I'm going to go out to Jersey. I'm just going to go out to Jersey and figure it out. India Home also is a nonprofit in Southeast Queens who's doing some great work around this. We've actually invested, I think, upwards of almost $1 million into home sharing. So they have a program, and they're actually expanding it out a little bit more, where you have older adults living collectively together in homes that they're purchasing across the borough as well. So we do need to see a lot more of that. And like I said, the approach at Creedmoor is really going to be a great model, I think, that we can replicate in areas where there's land. And especially, as you said, you talked about transit deserts. So even at the Creedmoor site, as we thought about the bus redesign, we were having those conversations with the MTA. And of course, we all want to see fares expanded more, right? And perhaps more resources being put in there, being that we know that the MTA is going to continue to raise, the prices.
I love the question. Thank you. I'd also just mention, if you're interested in this topic, recent Cuff report was actually about retaining more of New York City's young families.
Right.
But we showed in that report that there are about 70,000 older adults in New York City who are living alone in a 3+ bedroom apartment or home. Could some portion of those folks benefit from a roommate or being able to live in an intergenerational setting? Could some folks potentially move into brand new high quality senior housing, but opening up more larger units for families that are struggling? So I think there's a double-sided, opportunity there that potentially could also include building more of those larger units, which in new developments generally aren't as financially advantageous for the developers because they get more per square foot for for studios and one bedroom. So there's a few interesting things that might be
And I'll just
useful
add,
there.
through the Long Island City rezoning and the Jamaica rezoning, there was a real big push to make sure that studios weren't just being done. Like, we were very intentional on saying that we need to see 2s and 3s so that families can stay together as well.
And but we can also talk to Anderson Torres here as well, who's talked a lot about the opportunities to help more older adults potentially live together in some of these large units. So I did see one more question at the back. I wanted to get to you as well. Microphone was coming your way from one side or the other. Yep, there you go.
Thanks, Eli. Kendall Christensen, representing the Congregational Home Legacy Fund. Councilmember, good hearing on the solid waste management plan yesterday. But for Borough President Richards, for your housing agenda, we're funding a project targeting the 250 Section 202 funded senior housing projects in the city, many of which are in various stages of distress, all of which are 20, 30, 40 years old, and would we have a proposal in front of the mayor. The council's been supportive of it in the last budget round and the like, so I want to make sure that that doesn't get overlooked, the opportunity to preserve and expand and improve that segment of the city's affordable housing portfolio for seniors.
Thank you. Appreciate that. Thank you. And I saw a hand go up in the second row. Microphone's coming your way. If you just lift your hand up so my colleague can see you. Yep. Great. Thank you.
Oh, I mean, I look forward. You're totally correct on that. We should be looking to preserve and make sure that we're doing everything to ensure that seniors are living in quality housing as well. So I look forward. We should have a conversation offline on perhaps some properties we can look at across Queens that may be in distress as well that we can work collectively on.
Hi, everyone. I'm Jennifer Bisram. I'm a reporter and anchor with WCBS here in New York. You probably didn't know, but we have a series called The Cost of Caregiving that focuses on older New Yorkers that airs once a month, so please watch it. The next one is on Monday, and that's why my question. This one we focus on food insecurity. And both of you talked about that a little bit. One of the things I learned as I was doing this story was that, I know the pantries are filling up, which is sad also, and we have to get them help, seniors more food, but also the homebound seniors. And it broke my heart to find out that seniors are only required to get 1 meal a day for only 5 days a week, not 7 and not 3 meals. And so we interviewed seniors, and that 1 meal stretches. They save that, or they eat it like around lunchtime so it can kind of balance their day. For me, that's sad, right? And I'm sure for a lot of us in this room, I'm sure none of us eat just 1 meal a day. So my question to both of you, what can be done, what's being done, if at all, on your levels, in your areas, just to kind of help these seniors be healthy?
So in my district, we partner with an organization called the West Side Campaign Against Hunger. where we host a monthly food pantry where families get groceries for weeks so that they don't have to rely on these day-to-day deliveries, and so that they can eat those 3 meals a day. And so I think we need to invest more in these food pantries that provide healthy grocery items that aren't dependent on the day-to-day, so they can have their 3 meals a day. I think that would go a very, very long way.
But there are a lot of cases where they can't cook, right? The reason why they're homebound is because they can't, get around the stove like some of us do. So in situations like that, how do you help them?
In that situation, we need more deliveries. We need to invest in the human capacity to making sure that folks are getting their meals, especially if they're unable to prepare those meals.
And what I say is just getting back to what I was saying earlier, we need to ensure that our nonprofit partners and our older adult centers are getting more resources. And every time I go to an adult center, there's not a seat in the house anymore. And there's a lot more that they can do if they're given the resources. We're going to be convening actually a roundtable in the new year around food insecurity in Queens. It's a shame 1 in 3 children are even food insecure in Queens County. And then you on top of what we're seeing at the federal level, where we have the Trump administration targeting immigrant communities who are scared to come outside. So we have a lot of work to do to ensure that our partners are getting more. And, we're working with corporate partners as well. We just did 6,000 meals for Thanksgiving. We also delivered, we used our nonprofit partners to really get a lot of those meals out the door into older adults' homes as well, so that they can drop off. But our nonprofit partners are really critical, because you're not just, as an older adult, letting anybody in your house either. And we know that with organizations like Woodside on the Move, right, India Home, like these organizations, SNAP, there's so many great older adult centers in Queens County who people who our older adults trust. So we need to make sure they're getting more resources. Meals on Wheels, they could do more if they get more. So everybody's stretched is what I want to say right now. And that's what we're hearing, whether you're a church, whether you're a mosque, everybody is feeling the pinch right now. And this is a question of policy and what are our priorities.
And to add on to that, we also need more investments in home aid workers too.
Mm-hmm.
My late grandmother, she would have a home aid worker who would prepare the meals for her. That was her chef, basically. And so I think that's going to be very important. I know there's not enough right now. We need to make sure that there is enough, because they don't only provide care, literal physical care, they also help prepare a lot of these meals. So the grocery deliveries that we're referring to in our office, if there's a homemade worker at home that can help prepare those meals, I think would be a perfect combination.
And they need to be paid better.
Correct.
So that's a big detriment to getting more people into that particular sector, because they're not paid enough. And this conversation has been happening. I think Assemblymember Ron Kim has been beating the drum on this, but we got to pay people.
Well, that's a good way to end, but can you join me in giving a big hand to our great panel? To the borough president and the council member, and for all your important leadership in this city and in your communities, thank you so much. Thanks for being here today. Also, can I get a hand for Eli, our great moderator?
Must have been 3 hours.
Eli.
He's from Queens, a lot of stamina.
Stamina.
And thank you all for being here. Thanks for sticking around. Thanks for everybody viewing online. I will say just really quickly that check out our work, our research this year that we did with AARP on the financial security crisis facing older New Yorkers. A big thank you to AARP New York for making this event possible. Thank you, AARP. And also, I'll say that we are going to be having an event. Mr. Jourdain, we are going to be having an event on ideas for Queens in just a couple of months. So we're going to call on the borough president again for that one. Thank you again.